All right, so a bit of recap of what we had learned yesterday. So for those who didn't attend yesterday's session, yesterday we were looking at KenyaEMR navigation. We had started from looking at the overview of KenyaEMR, various modules that are supported within KenyaEMR, various departments that are also can be supported using KenyaEMR. We looked at how to navigate from one point to another, like end-to-end kind of navigation. We looked at the encounter forms, including the green card and all other encounter forms that are there. We had looked on how to register a client, a new client, how to enroll them in HIV service. We also looked at how to search for an existing client using KenyaEMR. So finally, we also looked at how to do a lab request. Our clinician can do a lab request using KenyaEMR, and also how a clinician can do drug prescription directly using KenyaEMR. So those were the key areas that we had looked at yesterday. So today we wanted to focus on the other modules like PrEP, OVC, and OTZ. But again, as I've mentioned up there, we want to spend a few minutes taking guys through the HTS module within KenyaEMR. So I want to just take a few minutes and go through that. So I just want to share the screen so that I take you through how we can do HTS using this system. I don't know if you're able to see my screen.
Yes.
Yes, we can see.
Yes, we can.
Is it visible?
Yes.
Okay.
Yeah, it is.
Yeah, so I think for those who have the URL, you can also log in. So then we do this together. Sometimes it's always good to learn. You are also doing it on your own. The login credentials, I guess, are already shared. If you don't have, just feel free to raise up your hand so then I can reshare the URL with you. So I'll just straight away log in. So the username is test user and the password is test1234, capital T. So as we had learned yesterday, the first thing that you see when you log into KenyaEMR is the landing page, which is the facility dashboard. So after that, we go to home. So what we are going to do today, we are going to kind of get a client who is coming in for any other service, but we want to take them through the HIV testing and counseling session. So if you look at the home page, if you look at the KenyaEMR home page, we have HIV testing services there. But before we use it, we have to register this particular client. So I'll just go through the registration process. So I'll just click on the first icon, which is registration. Then I'll click on find or create a patient. So I'll just click on that. My interest right now is to my interest right now is to create a new client. So I'll just click on create new patient. Then I select register new patient. Okay. So this is the registration window where we register a client. So I'm going to proceed and give my client clinic number. This can be given at the HTS. So maybe I'll give my client 56789. Yeah. Then ID number I don't have to give if it is available. Like for now, I think I can skip that. Then I'll enter the first name. So this is HTS client. Yeah, with my name so that I know I'm the one who created this. My client is going to be a male client, and I want to create the date of birth from age. So my client is aged about 30 years old, and this is reported in the midterm, that is 15th June 2020. I can say maybe it has been reported today on 18th. Yeah. So sometimes I can just say this has been reported today, or if it was yesterday, I can say it was reported yesterday, depending on when the client has reported that. So now we know our client was born on somewhere June 1990. So marital status may be single, occupation may be other, education may be secondary, or let's just say college. Then you don't have to use the deceased section. Yesterday, guys were wondering whether the deceased section is for recording those who have died already. You don't need to use it when you are registering a client. You only use it when a client has been discontinued, and the reason for discontinuation is death. So that's when you come back, edit here, and say the client is dead. Then you enter the date of death. But when you are enrolling, you just skip it. So the phone number we can use 0711000000. Then because of time, I don't want to enter all the locator information. I just say maybe this guy is coming from Vihiga. Maybe the landmark is some M-Pesa shop next to their home. So then Vihiga Hospital. If at all there's an next of kin, we can pick that. In this case, we don't have to. In this case, we don't have to. I don't know if the screen is clearer or it is too small. You can let me know, so then you don't have to strain your eyesight. So I'll just save. I'll just create this client. So as you can see, KenyaEMR is validated, so you cannot register same ID twice. So someone else is already using this ID. So all I can do is maybe change something, 56780. So then I just click on that. Good. So we have created our patient. We have registered a patient. Okay. So the next thing we want to do, we want to start them on the HTS service. So we click home, then we click the HTS, the HIV testing services icon. It's the third one. If you look at it, it is the third one on that row. So when we click on this, we have nothing shown. So the next thing we want to do is to check in the client for this visit. So it is the action of checking in that KenyaEMR will respond by giving you any other form that is appropriate for that particular patient, depending on which service the client is getting. So I'll click check in. We are checking in, let's say yesterday, we want to do retrospective. So this is HIV testing that was done yesterday, 17th June. Then we submit. So the moment I check in, now you can see I have additional forms. So for this particular patient, the forms that are appropriate for the patient is the Triad Form, the HTS initial form, and the HTS eligibility screening form. Okay. So the first thing that we do is to, I'm sure people usually start with the triaging, so we can just do a quick triage. This patient is coming in for HTS services. Temperature is okay. Lucy is raising her hands. Lucy, kindly go ahead.
I need the URL to log in.
Oh, the URL. Okay. Just a minute, I share.
Okay, thanks.
That is the URL. Are you able to see it?
Yeah, thank you.
Let me know when you are done so that we can continue. Should I continue? Lucy, are you okay?
Yeah, I'm good. I'm good to go.
Hello.
Okay. Okay, so we can continue. So I think we were at a point where we were doing the triaging. We were entering the vital signs. So temperature will just say maybe 32. Pulse rate maybe 89. BP is 128/90. Respiratory rate maybe is 90. The other one is 90. The weight is about let's say 70, and the height is 172. So you can see the BMI is automatically. Kindly for the rest who are joining, kindly mute. So then we only have one presenter. So we don't have to enter MWAC. We can just save the form. So you can see the form is dropped under the completed visit forms. So the next thing is now the eligibility screening for HTS, just to kind of gauge the suitability of this client for HTS. So we click on that. Population type. Population type is either hospital patient or non-hospital patient. Department is maybe OPD or IPD. History of HIV testing. Maybe they have never tested before. So obviously the client is eligible for testing today. So we can save that. Okay. So then at this point, we are going to start the HTS initial form. So we just click on this form. Okay, then we state the date of HTS. So as we said, it was done yesterday. So the 17th is the right date. Population type, maybe it's general population. Does the client have any disability? Maybe no. If we say yes, then we have to specify. In this case, no. HIV testing history. Has the client ever tested before? Maybe no. Has the client done self-test in the last 12 months? Maybe no. Indicate HTS strategy used. So maybe we are using the integrated VCT. Okay. So that gives us the entry point to be VCT, but you can change if you feel that VCT is not the right one. Okay, then as the client consented, so the client has to consent for you to move. So if you say no, then you cannot move. But if the client has consented, that is when you are able to move. Okay, so I'll say yes. Client is being tested as individual. Yes. The kit name that has been used. So maybe the kit name is called determine. Lot number can be any number, depending on what is on the kit. The expiry date, maybe it is expiring in November, and the test result for this test maybe is positive. So that gives us a chance to do the second test, the confirmatory test. So we do the FAR, then we enter the lot number and the expiry date for this. And then the test result also maybe is positive. Then we have to specify whether the client got the result. So we say yes. Then we look at whether the couple is discordant or no. So automatically it is not applicable, because up somewhere here we said that we are testing this client as an individual, not as a couple. So that's why the system automatically selects not applicable. Then the next part is TB screening, which I guess is being assessed. So for our case, we can say no TB sign. Then if at all we have any remarks, we can write them there. Then we enter the form. Okay, so that concludes our first test. So because our client is positive, we are going to do a retest, just the pre-enrollment test. So we get the same, the form looks the same. Okay, so we'll do just the same. So this one we can do faster because we've already seen it. Integrated VCT, consented yes, individual, kit name. Expiry date, result is positive, FR, result is positive, result has been given, no TB, then any remarks, then we enter form. So if you look at this window, all we have here is like a summary. And you can see the test history, like the first test was positive, the second test is also positive. So at this point, this patient needs to be linked. So the counselor should come back to the system and capture the linkage information. So we just open that linkage form. So the facility link to, if at all it is this facility, you just tick on the checkbox. Then the current facility will be automatically populated. Then the unique patient ID that the counselor got from the CCC is being captured here, and it is mandatory. So we'll just capture that. So let's say it is 131 55 56780. I hope all of us know how to create a unique patient number. You just combine the facility MFL code and the patient serial number. So that is how I'm creating mine. Then the healthcare worker handed to, now you capture the name, maybe Josephine Karanja. The cadre could be a nurse. Date enrolled, so maybe they were enrolled on the same date, and maybe they were started on ART on the same date. And if at all there is any comment, you capture that comment at that point. So That is all in the linkage. So then the counselor just enters that form. Okay. So you can see now we have like a more complete picture about this patient. If you look at this, so we know the facility where the patient was linked to. We know the unique patient ID the patient was given. We know the date they were linked. So in a summary, we know too much about this patient so far as HTS is concerned. So the last bit, which maybe I also need to share, is how we do contact listing. So if you look on the far right in the provider actions, we have the contact listing link there. So we can quickly click on that and maybe elicit for contacts from this particular patient. So we can add contact, and maybe this contact is now called, let's just call Msichana Mzuri, just to save time. This is a female, maybe aged 25. Then maybe it's a single lady, and physical address and all. Maybe we don't need to capture that because of time, but we can just say some Mugumotri along the way. And the phone number is 07221111. Okay. Then relationship, maybe it's a sexual partner. Living with client, maybe no. But the moment we say this is a sexual partner, the system will prompt us to complete the IPV questions. So we have, has he ever hit you? Has he ever kicked you? Has he ever threatened you? All these questions that people ask during the IPV. Then the outcome, depending on what has been given under the IPV, we have the false. Then the baseline information. So HIV status, at this point, we can say unknown. If at all it is known, sour. So we can say it is unknown because it is reported. But as a counselor, I think there's a way you can book this particular contact. So then you can kind of look for them and get to test them. So maybe this has been scheduled for 30th of this month. They'll be looked for. And then the PNS strategy, maybe is a passive referral, depending on whichever that is applicable at that point in time. Then you save. So you can elicit as many contacts as possible. You can add contact all the way, even if there are 1,000, depending on how many contacts are available. But because of time, I don't think we need to do that. But if you kind of go to the history, you can now trace this particular contact and add the trace information. Okay. If at all you have traced them, you can click on the date you have traced them, and also the contact type, whether it was physical or phone, and the outcome. So you can keep on tracing this particular client as many times as possible until that point in time when you get them and you get them tested. So I wouldn't go to the tracing information, but it is available. You can always trace each and every contact. Okay. If you trace them and you get them, you can always click on register so that you can register them in the system, do the HTS, and again see whether they are positive or not, and elicit for more contacts. Then the last thing, the system provides kind of like a contact tree where you can now see this index client, akuna contacts wangapi. They'll all be listed here. It's kind of a tree depending on the number of contacts that are available. In this case, we only have one contact, but if we had more, they'll all be linked under this. So it's always a good thing to kind of give you a picture of how this guy has contacts. So that's all when it comes to HTS, unless there is any pressing question. If you have a question, you can post it under the text, under the chat area, so then we can help you address the question. Otherwise, I think maybe we can just get one question before we move to the next presenter. So I would like to open the floor. We are at 2:38. So 2 minutes, then we can move to the next presenter. So the floor is open. Just raise up your hand, then I'll unmute you. Okay, seems like there are no questions, so I guess we could just move to the next presenter. Let me check if there is any question in the text area.
Excuse me,
Yes.
I've posted a question at the chat box.
Okay. You want to just ask the question?
Yes.
I kindly
So
ask.
when you are doing eligibility screening, one of the reporting that we do is for non-positives in the 3 p.m. But at the point of eligibility screening, there is no that option to put that bit. So how would you use this to generate that report?
So you are asking about the
So the
HTS eligibility?
client is not, yeah, the client is not eligible for testing, so you will indicate no.
Yeah.
So if you indicate no, there is a reason why the client is not eligible.
So I thought all these questions is what leads to either eligibility or not eligible, unless,
Oh, yeah.
because I can see the history of testing. The patient maybe has tested before, and maybe the testing result was positive. In that case, are they really eligible?
So they're not eligible. So I think we can pick cases from there. But what if you want to know the other reasons why they are not eligible? Because you don't just use the test result to determine the eligibility, whether a client is eligible. The client could have been tested negative and they are still not eligible for testing this time.
Okay, so
a way for us to analyze those reasons for non-eligibility.
So in the physical paper, in the paper document, do we have any other reasons for non-eligibility other than the ones that are provided here?
Yeah, the client could be eligible for testing. For example, it's let me give you an example. Maybe it's a 13-year-old could be eligible for testing but no consent. Then they could be eligible for testing. They can also decline. So we won't go ahead with the HTS. And so we would want to know those reasons why these clients are not proceeding on, and also the reason why the counselor is determining or the counselor is indicating as not eligible, for us to be able to like improve quality of services, you know, and all that.
Okay. All right, so I think I'll note that. Then maybe towards the end, we can have another round of discussion just to be sure that it's either if it is a gap that can be addressed, then we can have it be addressed, or if it is something that maybe there is any other intervention to ensure that we can capture that, or if it's about adding maybe a comment section for qualitative kind of data. I've noted it, so let's have that discussion maybe the next presenter.
Thank you.
All right. Okay, so I think at this point I'll invite Frida. Frida is one of our stakeholder engagement and capacity building advisor. She'll be taking us through the prep module. Then later on we could go to the other modules. So Frida, if you are on, kindly take it away.
Yes, I'm on. I would like to share my screen, so I don't know if you just, okay. Good afternoon, guys. My name is Frida Oyucho. As Bernard has said, I'm a stakeholders engagement and capacity building advisor. Please just confirm if you could hear me, and also if you can see my screen.
Yes, we can.
Okay. So I'll be taking you guys through the prep module. I'll be showing you how to do the prep enrollment, how to fill in the prep initial form, the prep follow-up form, the prep refill form, how to do the lab orders for the tests that are necessary for prep, how to handle a client who has missed appointment, and also how to give the clients the prep regimen. Okay, so I already registered my client for the sake of time. So I'll just quickly go to the registration and search for my client. Okay. So this is my client. So we are just going to navigate to the prep module. I hope you are all able to see the prep module. So this is how the prep module looks like in KenyaEMR. So you'll notice for you to be able to see any available forms, you have to check in for the visit. So I'm just going to check in, but I'll backdate. I'll backdate so that we are able to fill all the other subsequent forms. So I'll just backdate to 1st of January. Okay, so oh, sorry, my patient has already been checked in. Okay, so if you look at the eligibility summary, you'll be able to see that there are reds and there are green. So for the red shows that the patient is not eligible. The green part shows that the patient is eligible. So for you to be able to enroll the patient into the prep module, all these, the color code has to be green. All of them has to be green. So the first thing we are going to do, I think maybe just a second. Okay, so the first thing we're going to do is we're going to fill in the triage form so that we are able to capture the vital signs. So I'll backdate the date as well. Can't do that. My patient, still an outpatient. Let me just check the patient out. Sorry for that. Okay. Yes, so I'll fill the triage form. So the reason, maybe just prep. Then you'll be able to fill all these details as we have seen from Otieno's presentations and the other presenters from yesterday. So I'll quickly just go to the weight. Say I'm working with 58 kgs and the height is maybe 162. Then I'll enter the form. So once done, the other thing before you enroll a client into the prep module, the client has to be HIV negative. So I'm not going to do the HTS eligibility screening form because Otieno has already done that. So I'm just quickly going to do the HTS initial form, but this time it's going to be for a negative patient. So the date remains the same, 1st of January. We're going to choose the population type. So if your patient is a key population, you'll be able to choose from the options available. If your patient is also a priority population as well, you'll be able to choose from the options available. If your patient is disabled, you'll also be able to choose from the options available. Then you'll be able to indicate whether the patient has ever been tested before or not. You'll also be able, if you indicate that the patient has been tested before, then the system will prompt you to put in the month since the last test. Then you'll also indicate whether the patient has ever done self-test in the last 12 months. Then you'll go to the HTS strategy, indicate the HTS strategy used. So the moment you indicate the HTS strategy, the system automatically auto-populates the entry point. Then you'll indicate whether the client has consented. Remember, if the client has not consented, you basically can't do anything. Then if the client was tested as individual or couple, then the kit name, you can choose to enter the lot number or use the last lot number. Okay, so in my case, there's no last lot number. It was not entered before, so I'll manually just enter it. I'll also put in the expiry date and the test results. So you'll also indicate if the client was given the results. If TB screening was done, you'll also indicate whether there was no TB sign, presumed TB, on TB treatment, or not done. Then you'll enter the form. Okay, so if we go to the prep module, you realize we still have one indicator that does not qualify this client to be enrolled in prep. That is the willingness to start prep. So the next thing we're going to fill is the prep behavior risk assessment. So this is how the form looks like. Okay, so you'll be able to indicate the sex partner HIV status, whether they are positive, negative, or unknown. Okay, so if the partner is unknown, the status is unknown or positive, definitely the client is at a high risk. Okay, then down here there's a whole bunch of screening questions that you'll also be able to fill as per what your client says. So for example, if your client has more than one sex partner, you can indicate. If your client does transactional sex, you can indicate. If your client inconsistently doesn't choose condom, you can indicate. So the moment you tick any of those options, automatically the assessment outcome is of high risk. The client is highly risk. So you don't get to choose the outcome, but the system automatically repopulates for you. Then is the client willing to take prep? So if you say yes, you move to the next section. If you say no, then the system will ask you for the reason why the client is not willing to take prep. So you can choose whether it's side effects, stigma, pill burden. Then you can also tell us if they were offered any risk education. Okay. And then lastly, referral for other preventive services. If the client has been referred to any other preventive services, then you can also just indicate. So I think my client is a male client, so I'll just refer them to the MMC. Then I enter the form. Okay, so I hope you're now able to see the prep enrollment service. So it only pops up when the client is eligible, and the client has to be eligible according to 5 indicators. So if any of the indicators, the client fails in any of the indicators, you will not be able to enroll the client in the prep module. Okay, so now we are going to enroll the client. So you just come here at prep enroll and you click enroll. Okay. So I'll still backdate to January 1st. So the client type, you can choose new if your client is new, or you can choose transfer in. So remember, if you choose transfer in, then a whole lot of, there's a transfer status down here that you'll be required to fill, though they are not mandatory fields. So this patient that I'm working with, I'll say it's the new client. Then also the population type, you'll choose accordingly. Then where the client has been referred from, you'll also be able to indicate whether VCT, MCH, or PD, all those other options. Then you'll key in the prep unique number. So the prep unique number consists of 14 digits. So it's the MFL code for the facility that the client is being enrolled in. That is 13. 155, followed by the year the client is being enrolled, that is 2020, and then now 5 digits, that is the number of the client in the facility. So for my case, I'll choose number 10. So the client is number 10. Let me just confirm if they are 14. Yes, they're 14. You also have the option of keying in the NHIF number if they're willing to give you, or if you have. Then now you can initiate the patient on prep. So first of all, we have the previous details, or details of if the client has previously been on prep. So if the client has previously been on prep, then the system will prompt you to put in the regimen that they were using before and the date last used. Okay. If the client has never been on prep, just click no, you move to the next place. So here the client's social status, ideally this is supposed to pre-populate from the HTS section, but that is not the case right now. So eventually you'll be able to see whatever you chose when you're doing HTS, whether the population it was general or priority or key population populated here. So I'll just key in the adherence body details. So once my form has been submitted, you're able to now see the patient has been enrolled in the prep module. So to know if the patient has been enrolled in the prep module, you're able to see the discontinue bit of it, or the discontinue button. So that shows you that the patient has been enrolled in a service in KenyaEMR. So the next form you're supposed to fill after the patient has been enrolled is the prep initial form. So you'll be able to see that under the available visit forms. So you'll just click on it. Okay. So this is how the form looks like. So the prep initial form contains screening questions, laboratory questions, and part of the prep status. Okay, so we are just going to fill the screening part, the STI screening section. So if the screening was done, or if you did your screening to your client, then you'll be able to indicate the signs and symptoms, if there were any, and then you'll indicate whether the signs and symptoms were treated or not. Okay. If the screening was not done, you move to the next section. So because my client is a male, we are only going to see the VMMC part. We are not going to see the fertility intentions. So I'll screen as well for the VMMC. So VMMC done. I'll say yes, or you can say yes. Then you can indicate whether your client is circumcised or not. So if you say your client is circumcised, that's the end of it. But if you say your client is not circumcised, then the system prompts you to refer the client for circumcision. Sorry? Okay. Okay. So we'll say this client is circumcised. Also, if you say it's unknown, meaning you don't know whether the client is circumcised or not, still the system prompts you to refer the client for VMMC or circumcision. Then the next section, we have the chronic illness and comorbidities. So we all saw this yesterday from the green card, so it is exactly the same. If you say the client has any chronic illness, you're going to choose, there's a whole drop down of illnesses that you're going to choose from. Then you can also key in the onset dates, the drugs that the clients are currently on, the dose, unit, frequency, duration unit. Okay. If you say no, you move to the next section. So the next section is adverse drug reactions. Also, if you say the client has any reaction to any drug, you'll be able to also choose from the drugs listed below, the drugs that are causing the reaction. Then you can choose the reaction itself. Then you can also tell us how severe the reaction is, and the date of onset, and the action taken, okay? It is exactly the same as also non-allergies. You'll be able to choose if your client is allergic to anything. You'll be able to choose what is causing the allergy, the reaction, how severe the allergy is, and the date of onset. Okay. The next section of this form is the laboratory investigation. So also something key to note, under the laboratory investigation, you can't key in the results, okay, or the results date. This part pre-populates from the lab orders that you're going to see immediately we are done with this form. So if we open the next form, under this section, we'll be able to see any lab that was done pre-populated. So for now, we're just going to scroll down. Under prep status, so we have, if your client has any signs and symptoms of acute HIV, you'll indicate. So remember, if your client has signs of acute HIV, automatically the system tells you to discontinue the client, because now you can't start them on prep. Okay, so we're going to say this one doesn't have acute HIV. Then the system will ask you whether adherence counseling was done. Okay, then if there is any contraindication for prep. Sorry? Okay. Then if then the system will ask you for the prep treatment plan. So because this is the first, this is during initiation, we're going to say we are starting this client on prep. Then the system will ask you whether condoms were issued. If yes, the number of condoms that were issued. So I'll just say 30. Then the next thing will be the next appointment. If the client was given any next appointment, you'll indicate, and you'll indicate the appointment date. So I'll just say February 1st. So that is it for the form. Then I'll enter. Okay, so now we've enrolled the client on prep. We've filled the prep initial form. So now the next thing is you're going to fill the prep follow-up form. Now, as you can see, under available visit forms, there are no forms. That is because currently the system only allows point of care for the prep module. So like this is the first visit. So if the client comes for the next visit is when you'll be able to see the prep follow-up form. So what you're going to do is we're just going to check out, then check in for the next visit. But before we do that, I'd like us to just do a lab order to capture the creatinine so that when we do the prep follow-up form, inside the form we'll be able to see, under lab investigations, we'll be able to see the pre-populated lab results. So I'll just click on lab order. Then I'll create new lab, new order. So I want to order for creatinine test. So I believe creatinine is in both blood and urine, so I'll go with the urine. Then under the urine, you'll be able to see a whole lot of other tests. So I'll choose renal function panel. Then if you scroll down under renal function panel, you'll be able to see all other tests that apply under the renal function panel. So I'll choose the serum, creatinine, sorry. Once I've done that, I'll just click confirm. So when you confirm, there is the part for action. You can choose to do this when you click confirm, or you can choose to do it just beside the test. So I'll put in the date that the test is being ordered. because we enrolled my client in January, so I'll just say January 1st. Then I'll also key in the reason. So it's baseline because it's the first time. Then I'll save. Okay, I can as well decide to do for hepatitis B. So I'll just go to blood. Under blood, I'll be able to see a whole lot of tests. Then I can click on hepatitis B. Then when I scroll down, now you can choose the test that you want to do for this client. So I'll just choose hepatitis B, then I'll confirm. Then I'll remember to always key in the date that the lab investigation was ordered. So January 1st, then I'll also key in the reason. So this is also baseline as well. Then I'll save. Okay, so I'll be able to now see the active orders. So I'll come to enter lab results to just enter the results for the lab. So for creatinine, I want to put a figure of 60 because anything below 50, that means the client has kidney failure, and that means we cannot give the client PrEP. Okay, then I'll also key in the results date. So on the same day. So I'll do the same thing with hepatitis B. So I'll say it's negative, and I'll also key in the date, which is 1st January. So I'll save. Okay. Then when you go to previous lab order, you're now able to see all the orders that you've already ordered for, and the results have come, or you've entered the results. Okay. So now I'll go back to my client. I'll check out the client. Remember to check out with the date the client was, the date you checked in for the encounter. Okay. Thanks. 1st of January. Okay. So it's fine. I'll just manually check out. Then I'll correct that from the chart. So once I've checked out, so this client has come for the first visit, or you've entered details for, this is the enrollment or the initiation encounter. So when the client comes in for the next visit, now you'll be, you're supposed to now fill the PrEP follow-up form. So you'll check in for the visit again. So for my next visit, I'll check in my client. My client was supposed to come in 1st of February. So I'll check in 1st of February. Okay, so once you check in, you're now able to see the available forms. You're able to see all these forms that we filled, and you're also able to see the PrEP follow-up form just down here. So because we've already filled the PrEP behavior risk assessment, the eligibility screening form, the HTS initial, the lab, and also the triad, I'll just quickly go to the PrEP follow-up form so that we see how it looks like. Okay, so this is how the PrEP follow-up form looks like. Okay. So when the client comes for a follow-up, ideally what is supposed to be done is there's supposed to be screening that is done. There's supposed to be at the end also screening done to the client as well. The client also is supposed to be done for behavior risk assessment and also laboratory investigations. Okay. So for this section, you're going to fill the STI screening, and we are also going to fill the PrEP status. Laboratory investigation has already been pre-populated, and then you're going to give the next appointment. So let's screen for STI. So if the client or you screen the client for STI, you'll be able to indicate yes or no. Okay. So if it's yes, you'll talk of the signs or symptoms, and you'll also indicate whether they were treated or not. Okay. Then for the VMMC screening part, I hope you're now able to see that it auto-populates whatever we entered in the initial form. Okay. And then we can go into chronic illnesses. So I'll quickly just say no to the 3 sections. Then under the laboratory investigation, you're now able to see the order date, the result date, and the result for the tests that we did. Okay, you're able to see the test for hepatitis B that we did. You're also able to see the serum creatinine test that we did. Okay. Under PrEP status, so you'll also be able to indicate the signs and symptoms of acute HIV. Okay, so as I had mentioned before, if the signs exist, then you can't continue the client on PrEP, you'll automatically discontinue them. So for the sake of demonstration, I'll just put no. Then you'll also be able to indicate the adherence counseling done, whether it was done or not. Then if there's any contraindication for PrEP, you'll also be able to just key in. Then the PrEP treatment plan. Remember, this is the second time. This is the PrEP follow-up form. So the client is supposed to be continuing with PrEP. Unless they missed an appointment, then now we restart, or they have any contraindication, then we discontinue. Then you'll also be able to indicate the condoms. If condoms were issued, then the number issued. Okay, then if the client was given next appointment, then the appointment date.
In 7-Eleven, we
Yes.
only report SGBV.
Sorry?
Sexual gender-based violence.
Oh, yeah.
Sexual, yeah?
Sorry? Okay. Okay, so I'll say my client is supposed to come back in March and enter the form. As I had mentioned before, because currently the PrEP module is purely POC, you're not able to see any other PrEP form until the next visit when the client comes. Okay, so what we've done is we've filled the PrEP follow-up form. So the next form that we want to fill is the PrEP refill form. So we're just going to check out February 1st. Okay. So now for the third visit that the patient will come to the facility, the next form that you're going to fill is the PrEP refill form. So as well, I'm just going to check in. So once you've checked in, you're going to see the PrEP refill form down here under the available visit forms. So also remember, when the client comes for the monthly refill form, you are only supposed to do the behavior risk assessment, adherence assessment, and then you give the client, you fill the monthly refill form. So that is what you're going to do. So when you click the PrEP monthly refill form, you can be able to also find the section of behavior risk assessment. Okay, so you don't have to fill the form that is under the available forms, open the monthly refill form, again fill the behavior risk assessment. You're able to find it here as well. So we're just going to assess this client for behavior risk. So if behavior risk has been done on that day, you can click yes. Then under there is a section for the sex partner. If the sex the sex partner or the client's partner is HIV positive, then you can indicate whether the client is trying to conceive, whether they've suspected poor adherence to ART, whether they have been on ART for less than 6 months, or whether they are not on ART at all, okay? So you can choose any that the client or the patient tells you applies. Then under the client's assessment section, also there are also the risk assessments or screening questions. You'll be able to choose what applies. If the client has sex with more than one partner, you can indicate that. If the client has been having recent STIs or transactional sex, you can as well indicate that. Then down here, we have the adherence assessment. So there is good, fair, poor, and not applicable. So if you say the adherence is fair, then the system will prompt you to give reasons why the adherence is poor. If you choose that the adherence is fair, if it's fair, the first one, you give reasons. If it's poor as well, you'll be able to also state the reason why it's fair. So because if it's good, then that's good enough. You proceed to the next section. So for this, you can choose fair. Let's say maybe there is pill burden. Then you'll be able to also indicate whether adherence counseling was done, okay? Then if you move to the next session, there's the PrEP status. So here you will be able to just indicate whether the client is continuing with PrEP or the client is being discontinued from PrEP. So we'll just say continue. So if you say they're continuing with PrEP, sorry? Okay. So you'll be able to indicate the prescribed PrEP, if PrEP was prescribed on that day, and the regimen that was prescribed, and number of months that the drug has been prescribed for, okay? Then if the client has been given appointment, you'll also be able to indicate, then you indicate the appointment dates. Okay, so client is supposed to come back. Okay, let's work with April 1st, then we enter the form. So now we've been able to see how to enroll a client on PrEP, how to fill the PrEP follow-up form, how to also fill the PrEP monthly form, how to do the lab orders. So I just want to show you, though, Juju, how to order for the PrEP drugs, because remember, for every visit that the client comes, you're supposed to dispense the drugs, okay? So you'll just go to the drug orders. This was done yesterday by Ogutu, so I won't go into detail. So for the PrEP drugs, you'll find them under other drug orders, okay? So you'll be able to indicate the dates for that encounter, okay? Then I don't know if that is the correct regimen. Then everything else remains the same as Ogutu had indicated yesterday for other drug orders, okay? So I'll just check out the client. So the next thing we're going to see is what or how to handle a client that has missed appointment. So this client was supposed to come back on 1st of April. So what happens if the client comes back 7 days after 1st of April? So we're just going to check in as well. We're going to say the client came maybe on 16th of April. Okay, so if you go to the PrEP module, automatically you'll be able to see it's not really an alert, but a yellow banner telling you the client has missed appointment by more than 7 days. So the system will require you to restart the patient on PrEP. So how do you restart your patient on PrEP? So under available forms, you'll be able to see the PrEP follow-up form. So you'll just fill it. So click on the PrEP follow-up form, then just do screening as we have done or we have been doing. So I'll just say the client has been screened. They were treated. They don't have any chronic illnesses, no adverse drug reactions, no known allergies. Then they don't have any acute HIV. Adherence counseling was done. Then there's no contraindication. Then now, instead of saying continue, now this is where you'll now click restart the client on PrEP. Okay. Then you indicate if condoms were issued and the number of condoms that were issued. Then you'll indicate the next appointment. If they were given the next appointment, then the next appointment date. Okay. Okay, so if you go back to the PrEP eligibility summary, now the yellow alert kind of is gone. Now your client is back, is actively now again on PrEP. So just points to note that what I've done is I've been doing monthly visits, but ideally that is not the PrEP workflow. There's a way PrEP is supposed to be, the drugs are supposed to be issued the way the clinicians understand more. Like for example, after the initiation, the client is supposed to be coming to the facility every month for the monthly refill, but the PrEP follow-up form or the follow-up is supposed to be done only after every 3 months. That is the 3rd month after initiation, the 6th month, and also the 9th month if they're still at risk. So that is not something that I've factored in here. I've just done, because of demonstration, I've just done monthly encounters. Okay. So I'll just check out. Okay. So that's it for PrEP. So maybe just a preview of PrEP reports. So under the reports, we currently have 3 reports in the EMR. We have the MOH 731B report for PrEP. We also have the PrEP register, and then we have the clients currently on PrEP. Okay, so I want to go into the reports as per now because of time, but please just take your time, go through the reports and just see exactly how they look like. Okay, thank you. If there are any questions, kindly just post them on the chat, then we'll be able to answer. So Ajuang, I don't know if you want to go next.
All right, thanks Frida for that. Just before Ajuang goes, I don't know if there is any burning question on the PrEP module. We could allow maybe for 3 minutes for maybe verbal question. If at all there is any comment or concern about the PrEP before we go to OVC or TZ modules. So I think I'll just open the floor. Just raise up your hand so then you could ask your question. Yes, Kenneth.
Hello.
Yes.
Yeah, I wanted to find out if, say, for example, you discontinue a client who was on PrEP, and then this client resurfaces maybe maybe after 6 months and wants PrEP, so it's going to be like more or less a new client, when you access the prep module, will it show you like you'll be restarting or initiating afresh?
Okay. Someone from Shinda?
Yes, for Shinda, you can hear us. Can you hear me?
Yes, yes, we can hear you.
Yeah. So we have two questions, but we'll ask one. The other one we are still preparing it. The question is on linkage. So you realize that there are patients who test positive, but due to one reason or the other, they are not able to start ART the same day. Yet in the HTS initiation form, it is mandatory to put the ART start date before, then you can confirm that these are linked. So does it mean that those who start symptoms and not ART are not linked? So that's the other one we are preparing. We'll ask shortly.
Okay, thank you. The last person. Okay, so I guess we could go with the two. So the first question is about PrEP. How do you reactivate PrEP clients who are in PrEP program but were discontinued for one reason or another? Is there provision to reactivate them? And if so, how? So I'll invite our team, whoever would want to respond to that before we get to the question from Shinda.
Oh, okay. So if you discontinue your PrEP client for whatever reason and then they come back, so in the EMR, there's normally the option for re-enrollment. So I don't know if I can share my screen again. Just a second. So for example, for the client that you are working with, so if we decide to discontinue this client, so just the discontinuation form, and then maybe we say low risk of HIV at that time, and the date for last PrEP dose. Okay. So the next time this client comes back to the facility, just a minute, sorry. So the next time this client comes back to the facility, you'll just check in again for the date the client came. So maybe if the client came today, let's choose another date. Oh, sorry, the patient is already checked in. I did see that. Okay.
I think, Frida, I don't know if you want to do this practically, but I think for the sake of answering Kenneth, is that there is a provision of enrolling a PrEP client. And again, what happens is that the profile for this client remains, even if you continue them. So that next time they come, the records are still within the system. You only proceed with the new interventions and the new and the counter forms that you fill after the reactivation. So the answer is yes, you can always re-enroll back a PrEP client once they get discontinued. So the second question is from Shinda. It's about the linkage field where the ART field is mandatory, and maybe some of the time, maybe you don't have to start someone on the same day. We had a discussion even today in our office, and we were like, okay, this is a mistake because maybe somebody is on TB drugs, so they should not be given ART drugs, and made to understand. So I think this is a bug on our end. We will just make the field optional. So yeah, we agree that was an oversight. So that will be corrected very soon. But thanks for pointing it out, even as you think of the next question, question number 2. So I think at this point, allow me to usher in the last facilitator, who is Bernard Ajwang. He will take us through how to use the OTZ and OVC module in the system. So Ajwang, karibu sana.
Hi, good afternoon. So I'm going to take us through the short session for today, and that will be on OTZ and OVC. These are new modules within KenyaEMR, and I think the key point we need to note for these specific programs is that we need to be sure on the eligibility for the clients we're enrolling, and once we make sure the criteria is certified, we should be good to go. So as you can see on your screen, I've got, I would want to first go to KenyaEMR, the homepage. And the first step, as always, would be to search or create a new client who meets the eligibility criteria. So I'm starting with OTZ. And OTZ, like we all know, is for teenagers and young adults between the ages of 10 to 24. But during enrollment, they must be at a maximum age of 19. Okay. So with that in mind, my colleagues have already shown you how to create new clients. So I just want to look for an existing client of mine whom I know meets the criteria. So I'm searching for Faye. So I have a client by the name of Faye Miranda, who is 10 years old, is a female, has already been enrolled for HIV service. That's one of the other conditions that must be satisfied. So at this point, I'll just want to check in Faye for our clinical visit. I want to backdate this to say April 15th. That is April 15th. And I submit that form. So once Faye is checked in, I think you can see straight away the available forms for the appointment clerks is only to carry out triage. But in this case, I want to skip this because we've exhaustively carried out this. So I want to straight away go to the clinical section so that the clinician can provide the services for these clients, all right? So our client is now checked into the CCC. You can tell all the other details. Their last WHO stage is PID stage 2. You're on that regimen, ABC, 3TC, and VP. And they are eligible on the left-hand side at the bottom because they are a child who is just gone into their teenage years. They are eligible for OTZ and they're also eligible for OVC. So the first thing we do is we want to enroll them into OTZ service. Enrollment date. I'll again backdate that to April 15th. At 15 that, I confirm the client is not transferring in and I enter this form. Okay, so my client is now enrolled into OTZ. Remember, they've met our eligibility criteria. So the completed forms at this point is the OTZ enrollment form. The next one, because this is a clinical area, you see the common forms that a clinician uses to see the clients are available: GBV, enhanced adherence, triage, green card, lab, TB, and so on, clinical encounter, and so on. But in our case, because we want to be specific for OTZ services, I'll go straight away to fill for them the OTZ activity form. So the visit date is now pre-filled for us, 15th April. And under the OTZ modules, I'm looking at on their first visit, I'll confirm that they've been oriented on the OTZ program. I'll confirm that they've participated in the activities of the day. Because it's their first time, the other activity I want them to confirm participation in is that they participated in OTZ treatment literacy. So the next section is looking at support group involvement. I would say yes, they were involved in the support group activities for that day, and make any general remarks about this teenager. I would say she's cooperative to fellow group members. Okay, and I enter that form. All right, so far we've now enrolled, we have completed an activity form. I think this is clicked twice, so we have 2 activity forms that I've gone through by mistake. All right, the next form that is critical for OTZ program is because we are monitoring their viral load suppression, I just want to record for this client the lab results, say from a previous visit. So on this particular visit, I'm interested only in the HIV viral load results. I'll say that they have LDL. This is for the date 15th April, and that is the day I'm recording the results. I ignore the rest of these other results because they're not important they're not very relevant for OTZ, and then I enter that form. Okay, so now notice that the due for VL is now gone off. All the information I have are the right ones for this client. It says the client is on ACT, they are on OTZ, and you have an LDL result over here. So far, that is the minimum that you need to do on a specific visit when a client first is enrolled and takes part in the OTZ activities. It's that simple. The next bit I want us to just confirm is I just want to show you the OTZ reports that are available within KenyaEMR quickly. So go to OTZ section, and you've got the OTZ monthly site level report and OTZ register and patients who are currently on OTZ. So like Frida indicated, you typically would need to refresh any new data you've updated in the system for that update to appear in your registers and reports. However, I wanted to just show us some previously enrolled people in the system. So if I quickly run this, because I know it's a very light report. Okay. Okay, so I'll wait for this report to populate. Yeah, there it is. I just want to view it within the app, and on this test server, so far, we only have these previous people who are enrolled in. in OTZ. So you notice it simply gives us the name, the CCC number, the bio info, what regimen they are on, and of course the last BL result, which is very important because we are monitoring whether they are suppressed or not. So that is one of the reports. I think tomorrow we'll go into all the reports from the system. So the last thing we want to do is I want to again look for my client and just show you what happens. Okay. All right, so the final stage is you've seen enrollment, you've seen filling for the activity form, and then the last bit that you typically do, like with any service area, is to discontinue should there need to. And you simply do that by clicking on this button over here and just confirming. I want to say like backdate that to May 26th. And I confirm the reason why I'm discontinuing this client from OTZ program. I could say they are lost to follow up, but it's only been 1 month. So I'll just say they've opted out of OTZ. I enter that form and that will be that. Okay, so that in a nutshell is the full cycle for OTZ program. Next one to take us through again, the OBC. So OBC again is a new program that has been created in KenyaEMR, and the eligibility for us is that the client needs to be a child, and then that child, what's most important is that child needs to be orphaned and should be accompanied or supported by a guardian. So looking into my existing clients again, the clients who are checked in, I have one person here called child. You notice I don't want to create any more new records. So I've got child. Child is on IPT, on ART, and is already enrolled on OBC. So that is not eligible for me. I want to check them out. Let me look for somebody else. Just read comment. Okay, so you know, typically one client can be eligible for more than one program area. So again, I've gone back to my earlier clients. Faye again is 10 years old. That means they are still a child. They're eligible for support. So straight away, I want to enroll Faye into the OBC program. And then at enrollment, I'll say we are enrolling on June 1st, Monday. Then I fill in this info. Is the caregiver enrolled in this facility? I will say, if I say yes, I'm prompted to enter the relationship, use the relationship feature on the patient dashboard to add the caregiver after saving this particular form. If I say no, then I'm prompted to enter the name and the details for this particular caregiver. So I'll say the caregiver is a male, say John, who is male, and their relationship to this girl is that they are an uncle to her. Telephone number 078 80123456. Do we have child protection information management? Are they registered there? If I say yes, I'm prompted to provide the CPMIS unique identifier. Okay, I'll use again dummy number, and then which partner is offering OBC services to this child? Because we are in Kisumu, let me say this is faces. Okay, and then I'm prompted and I enter that record. All right, so now we have enrolled this child into OBC, and so again, as part of OBC services, there are very minimal services that you'd be offered within this particular service area. I just want to note, 1 second. Yeah, so I'm just getting to this. There's no specific services that are provided to the OBC children, except that we record for them that they're enrolled into the service, and that enrollment information tells us their guardian information, whether they're in school and so on and so forth. So the next thing I would just want us to quickly look at is what are the reports that are available under OBC. So basically we have one report, patients who are currently enrolled on OBC program. If you click that, let's take a quick look at that. Yeah, so I've enrolled one client, but I need to refresh my ETL for that client to appear back on this test server. So that in a nutshell is what OBC is about. The last bit I would want to do is, let me just go home and show you. Again, same procedure for discontinuing a person from the OBC program. All right, so we enrolled this person on 1st June. We are discontinuing them today, that is 2 weeks later. And the reason is, obviously they are exiting without a graduation. So I'll take that as my reason and enter this form. And that will confirm that they are no longer supported, they are no longer an OBC in this facility. So in a nutshell, that's what OBC is about. I'd like to take it back to Otieno. I don't know if there are any questions around OBC and OTZ. Thanks.
Okay, thank you very much, John. So yeah, that brings us to the end of the OTZ and OBC session. So maybe again, we may just want to kind of give a few minutes for question. We are at 3:47, so we have about 13 minutes to close. So I'll just again open the floor if at all there is any question. The questions could range from HTS, PrEP, OVC, and OTZ modules. So feel free to raise up your hand and ask the question. Meanwhile, may I confirm if Afya Nyota is in the room? Afya Nyota? Seems we didn't have Afya Nyota today. Afya Jijini?
Yes, I'm here. Hello?
Anyone from Afya Jijini?
Yes, I'm here.
CHS Naishi? I think they asked a question, so I guess they're there. Okay, so I'll let Mugunda go first. Kindly ask the question.
Is on HTS, on PrEP. Hello?
Mugunda Catholic Dispensary, kindly
Can you
proceed.
hear me? I'm asking.
Yes, we
I'm
can hear
asking, on PrEP, there's the first visit, the third testing, and the 6 months testing. So on PrEP, where am I supposed to indicate that this client has been tested for that month and 6 months? On the PrEP tool.
Okay, I hope Frida has noted that. Next, let's have Shinda again.
Yes, so we'll ask our second questions that we let pending. So this question is on PrEP. So specifically on PrEP initial form, down there we have what we call contraindications for PrEP, which you have highlighted as non-confirmed HIV positive, renal impairment, not willing, less than 35 kgs, and 15 years. So if we were to develop a script to pull this data at the end of a certain reporting period, then what you put here are not contraindications for PrEP, yet they are reasons for discontinuing PrEP. So as per guidelines, there are only 3 reasons for discontinuing PrEP. So I don't know if you would wish to change the naming of that, or you want to insist on contraindication of PrEP. Thank you.
Okay. All right, anyone else? Right, so I think I'll let Frida respond to the first question, which was asking about how you document the 3 months testing on PrEP. I don't know if you want to respond to that before we get to Shinda on the contraindication on PrEPs.
So I don't know if I have the right answer, but when you're filling in the PrEP follow-up form, then for that visit, for that encounter, you are supposed to also fill in that is where now you're supposed to do the HIV testing, you're supposed to do the screening, also the laboratory investigation. So the moment you do the HIV, for the HIV test, the follow-up test, and you also fill the PrEP follow-up visit form, in KenyaEMR, it comes under one encounter, okay? So you're able to track by the dates exactly when the HIV tests were done. I don't know if anyone else wants to chime in. Ben?
Thank you, Frida. So I don't know if the person from Mugunda Catholic is satisfied before we get to Shinda.
Yes, I am. Thank you.
Welcome. So the next question I think comes from Shinda about the naming of this field where we have the PrEP contraindication. I'm very fast in my mind, I'm thinking then what is the meaning of the contraindication in this context? So does the contraindication, is it the same as reasons for discontinuing somebody from PrEP, or does it mean reasons for not taking up the PrEP service? So maybe I would ask the person who has asked this question from Shinda to clarify before we move to the next person.
Yeah, so I'll try and clarify more. So this is what I was saying. If you want to develop a script that you want to extract some data related to PrEP, then we have two things. We have reasons for, so we have contraindications for PrEP and reasons for stopping PrEP. Sometimes they look the same, yet from what we have here, we only have contraindications for stopping, contraindications for oral PrEP. So is it in order that we put the same under reasons for stopping PrEP for purposes of extracting the data using any script? That's what I was saying.
Okay, this sounds more clinical, but let me try. But then I think I'll be noting it down. So then maybe towards the tail end, we can ask someone from the clinical part to kind of respond. In my opinion, I think that there are two different things. Reasons for stopping PrEP or reason for discontinuing PrEP might be different from the contraindication. For me, the contraindication looks more like the reasons why I cannot start you, the reason why I cannot start you on PrEP, while the reason for stopping, in my opinion, is the reason why you are exiting from a service that you've been receiving. So for me, the contraindication sounds more like, before I start you on this service, what is it that will stop me from starting you in a PrEP as a service? Yet, the reason for stopping is you've been receiving a service. Now I'm kind of, I want to discontinue. Why do you want to be discontinued from this service? So in my opinion, that is how I look at it from the pedestrian, non-clinical pedestrian outlook. But I think I'm going to note it down, so then we can consider it towards the tail end, or we can give a more comprehensive response tomorrow. But thanks for raising this. We've quite noted it down. So the third person who has raised up the hand is Jacob Masai. You could ask your question.
So my question goes back again to the PrEP. And it would be also similar to the team that were before me. So as responded by earlier colleague that the testing is documented within the clinical form. At what point can we be able to extract this data that rhymes with the programming indicator, like we would wish to check month 1 testing, month 3 testing, so that we may be able to see whether we are optimizing the intervention? Is there a script that can be able to run a specific report that is able to get us those who are eligible, initiated, reason for initiated, as per my previous colleague? Thank you.
Interesting. It seems more like we have more SI people in the room. Most of the questions are that are related. So, okay, I wouldn't say there is a query, a ready query for that, but I'm trying to say that we are going to have a whole session on reporting from KenyaEMR, both from the standard reports and also from the KenyaEMR reporting tool. So then we'll be able to see how you can structure your queries in a way that you can run them from KenyaEMR data tool and extract any report, any ad hoc report that you may require from KenyaEMR. So why don't we kind of put that in the parking lot. We are going to have a whole session on reporting. We are going to plan for the next training on the reporting from KenyaEMR. I think we'll be happy to kind of guide in how you can structure your queries based on the indicators that you want to get from the KenyaEMR. So I'd request maybe we put that in the parking lot for now. I don't know if that is fair. Jacob?
Because I had also another related question in terms of the OTZ, but we can keep it in parking lot to ensure that we can exploit it during the reporting component. Thank you.
Thanks for understanding. Okay, so we are at 3:59. I guess we are at the tail end, and I see most of the questions that are coming under the chat are being responded to by our team. You can still keep asking. If you still have more, just type it and we'll be able to comprehensively answer. If we don't answer right here, we are going to export all these questions into a spreadsheet where we are going to provide responses per questions asked. We'll share the same with you. The other thing is that this training has been recorded just like yesterday, and you'll find the recorded clip in our YouTube channel. KenyaEMR, just go to YouTube and search for KenyaEMR. You'll find all the videos and all other materials that are that might be very useful to you. And as always, remember to subscribe so that in the future you can also get all those other materials. So I think tomorrow we are going to look at MCH. So we'll be going through the MCH all the way from the mother-child service to the mother services, everything about MCH. So kindly come early, log in on time. The session is usually open as from 1:30. So you can just log in, then we'll be starting at exactly 2. So unless there is any final comment or a question from my colleagues before we end the session. Okay, so seems like we don't have further questions. So I think it has been a good session. So tomorrow, let's kindly log in on time, so then we can go through the MCH component. So once again, thanks for finding time for this training. Let's meet again tomorrow. Thank you very much and have a good evening.
Thank you.
Yeah,